Hi everyone, we're going to talk about healthy vaginas today. I'm here with Dr. Molly Sears and Dr. Mary Ellen Tedeschi, and I'm Dr. Shreya Soni. We're joining you from all across the United States and Canada to share this information. So first we'll talk about vaginal discharge. It's normal to have vaginal discharge. The healthy expected type is clear discharge. It especially occurs during ovulation. That's when you would notice your cervical mucus is clear and more noticeable. You might have discharge in your underwear at that time. And then there is white discharge. That can occasionally be caused by yeast infections. It might even seem a little bit cottage cheese-like in texture. If you are having that discharge, it's important to tell your doctor and get tested and treat the candida yeast that could be causing this discharge. If that occurs, you may also feel very itchy and burning sensation. And then there is pink discharge. So that can occur if there is bleeding happening from your cervix or if implantation bleeding occurred. So that is if you got pregnant. Sorry about that. And there was implantation. And the other type of discharge is red or brown. So that occurs with menstrual blood. So brown discharge can occur before or after your period. Then there's the gray discharge, and that's what we're going to talk about today, bacterial vaginosis. So that is an overgrowth of this certain bad bacteria that can cause a lot of issues. And then any yellow or green discharge is also very urgent to tell your doctor about, because that can be an infection that could travel up and cause even more serious issues like infertility down the road or chronic inflammatory diseases.
Awesome. Yeah, and I just will add, the more you start to pay attention to your vaginal discharge, you'll start to see what's kind of normal for you. Some women make a lot, some women make very little. And so just knowing what your normal is, so when something outside of your normal occurs, that's more of a red flag for you that something might be going on.
And it also changes based on where you're at in your menstrual cycle. So leading up to ovulation, you're going to have more of a thicker consistency during ovulation. So midpoint, day 14 to 15 of your cycle, it's going to be more clear, more egg white in discharge, in quality. So it's interesting to track those changes for yourself too.
Vaginal odor. So it is normal to have vaginal odor. It's typically a musky scent. In the case of bacterial vaginosis, if there's a change to that odor, if it smells more fishy, that's a sign that there could be this overgrowth of bad bacteria that we need to treat. So it's important to know what your normal is for vaginal odor and be able to tell your doctor. And then around the time of your period, it might be more of a metallic odor, and that would be a normal finding. So if you have a vaginal odor, it's nothing to be concerned about, but it's important to know what your normal is.
And just like we have that collection of our microbiome in our gut, in our digestive system, our vaginal canal is an extension of that. So we want that healthy colony of bacteria to help outnumber the bad guys.
Yes.
Yes. Okay. So today we're going to mostly focus on bacterial vaginosis. And so when you really think about what exactly this is, it isn't a STI, it is just dysbiosis in your vaginal microbiome. And so like Dr. Mary Ellen was saying and Dr. Shreya was saying, we have these bacteria that make up kind of the community inside our vaginal canal, and they help protect us from infections, they help support our immune system, and so on and so forth. So it's been shown that generally lactobacilli is the most dominant probiotic in our vaginal microbiome. However, there is some newer research that's kind of questioning that fact, but generally that's what we're looking for in a healthy vaginal microbiome.
And interestingly, race also affects that bacteria that's popular. So it's more Caucasian people that have more of the lactobacilli. So there's a lot of new emerging research on that as well.
Yeah, so in that research, they basically identified 5 kind of patterns in vaginal microbiome, patterns that are normal. And they found that in some women, so one of the 5 types, they actually had very little to no lactobacilli. And so as that research kind of evolves, we'll be able to comment on kind of the clinical effects of that and how we would change diagnosing BV. But the reason to include that in this presentation is If you don't have any symptoms of BV, and you're not seeing any increased infections otherwise, but you keep getting diagnosed with BV, it's worth looking into that, or asking your doctor, or opening that conversation with your doctor that there is new research about maybe we shouldn't be diagnosing you with BV. So that's that tangent. Oh, yeah. Okay. So also the other thing about BV is, so lactobacilli is important because it produces lactic acid, and we like our vaginal microbiome to be acidic. That helps protect it from other infections. And so sometimes we'll hear from our patients that every time I have vaginal intercourse, I end up with bacterial vaginosis or some kind of vaginal infection. And that is because the semen is actually alkaline. And so it is shifting your pH from that healthy, protective, acidic pH to a more basic pH that's increasing your risk for other bacteria being able to grow and cause symptoms or things like BV. So normal vaginal pH is between 3.8 and 4.5. Again, that's maintained by that lactic acid from the lactobacillus. And again, if the species decreases, it allows for other bacteria to overgrow and results in BV. Usually we diagnose BV at a vaginal pH of over 7. And I'll actually have my women who are experiencing recurrent BV track this at home, so you can get your own pH strips from any kind of, store, and you can just take your own discharge and see what the pH is sitting around, and you can self-diagnose yourself that way. Do you guys have anything to add?
Cervical mucus pH is also an interesting thing to look at during ovulation if you're trying to get pregnant. So pH strips, if you have them, they can be used for all kinds of things. There's other conditions where you might look at the pH of your urine. So it is a useful thing to have at home, these pH test strips.
Awesome. And then the big question, how do we treat this? So if you are getting recurrent bacterial vaginosis infections, usually that is diagnosed with a swab, the pH of the mucus of the vagina, other symptoms as well. And then conventional treatments that you would receive from your medical doctor would be antibiotics, so either metronidazole or clindamycin, to help kill off that bacterial overgrowth and let those lactobacillus thrive again. Naturopathic treatments that we love are vaginal suppositories of boric acid or vitamin C or ascorbic acid. And this is because we want to further encourage that acidic pH of the vagina, so that way we're giving less of a chance for those bacteria to overgrow and cause the recurrent BV infections. We also want to repopulate with those healthy lactobacillus species. So this would be likely both oral supplementation and vaginal supplementation. So your naturopathic doctor would guide you through which are the best brands and the best sources to use in that case. And as Dr. Molly mentioned, monitoring that vaginal pH at home. So starting to use that as a tool if you are more susceptible to recurrent BV infections, taking a look and saying, okay, what can I do to help improve the acidity, make sure everything's healthy, and recognizing too that if you're in that cycle of recurrent infections, there's a lot we can do for gut health, relieving inflammation, improving your microbiome to help you get out of that cycle and to stop that BV from constantly regrowing and becoming more prominent.
Yeah, that's a great point. So your immune system does matter, and it's a good idea to support it here. So things like vitamin D, vitamin C, and like you mentioned, the gut health are all going to play into your susceptibility to infections.
Exactly.
And no, on the conventional treatments of the antibiotics, those are great when we really need them and we need to kill off an aggressive infection. However, the research that looks at the efficacy of using antibiotics in recurrent BV is pretty poor. We see it not really preventing that reoccurrence, and reoccurrence rates tend to increase the more you treat with antibiotics. And we have other videos about that kind of correlation there that you can check out. And then the other thing that I want to point out on this slide is boric acid is toxic if you take it orally. So just making sure that it's noted that that's a vaginal suppository only. Anything else, guys?
I think we covered it.
Okay, and then some
Awesome.
lifestyle treatments. Things like wearing breathable clothing, so you're letting kind of air flow in that area, and then avoiding antibiotics, antifungals best you can, because it's going to kill off all that good bacteria that's working to grow to protect us.
Just want to add, for breathable clothes, your natural fibers are really great. So that would be cotton or wool if you're in a cold area. But if you're wearing synthetic fibers like polyester, spandex, or in your yoga pants, that's actually the opposite of what you need for something like BV, because those synthetic fabrics are not breathable and they will contribute to overgrowth of bacteria.
Yes, and then back to the pH stuff, avoiding using tampons and letting that menstrual blood kind of flow out through your vaginal canal can help balance your pH. And then also using condoms when you are in the healing phase from BV, because it can prevent reoccurrence if your partner could be giving you more bacteria that your vaginal canal can't handle at that time. And then things like limiting sugar and processed food is going to help our immune system stay strong. And if we have other infections going on in our vaginal canal, sugar can actually feed them. So limiting that can be helpful.
Yeah, and with the antibiotics piece, I want to also say avoid those antibiotic soaps. The FDA has mostly banned them now, but I do remember there being a time when things like triclosan, methylbenzonium chloride were common chemicals in soap. Research has shown there's no need for that. Just plain soap is just as good and less likely to cause antibiotic resistance for you at getting rid of bacteria and getting rid of germs.
Yeah.
And avoiding any synthetic fragrances, artificial fragrances, keeping things as natural as possible is always a great way to go to.
Yeah. Less is more when it comes to cleaning your vagina. It's a self-cleaning thing, and it's gonna do just fine without using any aggressive soaps or chemicals to clean it. And you shouldn't need to. Anything else?
That was great. Great note to wrap up on.
Yeah, so as always, we're going to be doing a few more of these webinars. So if you guys have any ideas or topics you want us to cover, let us know.
Mm-hmm.
And we look forward to seeing you guys next time.
Thanks, guys.